I'm Sally Fullman, and I'm a woman sharing my experience about having osteoporosis. People who have osteoporosis know that it's a silent disease, so you don't know that you really have it. I first became aware of it when I was in my early 60s. I was going down the stairs carrying something and I couldn't see the end of the steps. I miscalculated and I fell and I sprained my ankle. It hurt a lot at the time, so I called my doctor and she suggested that I get an x-ray. I went over to the hospital. I didn't have to wait long. I found out that it was a sprain. It was bandaged, and I was told to take a couple of aspirin, stay off my feet, and that I would be better. But before I left, the doctor said, "Have you ever had a DEXA scan?" And I said, "No." "Get one." So about a month later, once my leg had healed and I was up and about, I went over to have a bone density scan, or a DEXA scan as it's called. And that was when I found out that I had osteoporosis. Now listen, osteoporosis means that you've lost 25 to 30% of your bone density already. So since I live in New Jersey, where I have access to hospitals, I know that I will get the right treatment. But what if I lived in a rural area or an inner city or an underserved area? Would I have that same opportunity? And the answer likely is not. But I want to build on that by saying this. It's so important that you have a bone density test so that you know you have osteoporosis and the degree of it. You know, if there were one thing that I could say to all of us about osteoporosis, it would be that it's time for us to be our own advocates. It turns out that there are so many other diseases that carry visible consequences. You know, it could be something dealing with diabetes or heart or respiratory problems. That osteoporosis is not only the silent disease, it's the forgotten disease. So we're the ones who have to say, I need help here, or can we have a certain program there? This is something that's important to me and to all people who are older. If within your community, you might say, we don't have any programs for senior health. Is there anything that we can do to initiate it? But what does it mean to you personally, not to be able to lean down and pick up your grandchildren and play with them? What does it mean to you that you don't want to go out because you can't get in and out of a car easily because your muscles are weak? So the cost in human terms, as well as financial terms, is something to keep in mind. And I think that at any point, we can get together and work toward a common goal.